going to be a really important video for you to watch. We're going to talk today about testosterone. And I think testosterone, unfortunately, sometimes is not well understood because we sort of think about testosterone for muscle building, sex drive, and we don't think about all the other things that it does. Unless somebody comes into their doctor complaining about problems with sex drive, erectile function, they can't build muscle, rarely do people check testosterone. The number one thing that men present with when their testosterone levels drop, and this is true of women too, is more anxiety, more depression, and more loss of sort of just love of life. So that's really the number one complaint. And when you go into with that complaint to your doctor, if you're a female or a male, they're likely to put you on an antidepressant, tell you to go talk to a therapist, or put you on anti-anxiety medication, and rarely are they going to be looking at testosterone as the culprit. And again, that's usually the first symptom that people will often have. If you're feeling more anxious, more depressed, it's not like you used to, either male or female, think about looking at testosterone. Now, when we look at testosterone, remember, you've got to do a few things. You have to look at not just at total testosterone, but total testosterone and free testosterone. Because it's honestly the free testosterone that matters, not the total testosterone. It's the free available testosterone that matters. So if your doctor is just measuring the total testosterone, that's not enough information. And that level of what you feel good at could be anywhere from mid-range to upper range. So you have to look at how you feel, not just what the numbers are. Let's say your testosterone comes out fine, but you're still feeling like low testosterone. Or you're on testosterone replacement and it's not working for you. One of the things that gets overlooked is that we have different androgen receptor sensitivity. So in some of us, we get very high levels of androgens, but our receptors are not very sensitive to the androgens, which means we need even more testosterone on board. And you can actually measure that. You can measure something called CAG or CAG repeats. And CAG repeats will tell you your receptor sensitivity. If you have more CAG repeats, it means you have low androgen sensitivity. So you've got like 15, 17 CAG repeats, you have low androgen sensitivity, and that's why you may need a lot more androgen. And if you have fewer CAG repeats, you have better androgen sensitivity. We kind of forget that the receptors are a huge part of this, right? It's not just the levels themselves. Now, when we're replacing testosterone, there's a lot of options. Injectable, we have transdermal, and now we have actually a new form that's oral. We used to not be able to use oral testosterone because it was too hard on the liver. A company called Marius Pharmaceuticals has come up with an oral lymphatically absorbed testosterone. So it bypasses the liver, so we don't see the liver bad effects. You take this twice a day orally. The nice thing about this is it physiologically mimics what our own testosterone does, which is up and down during the day. If you put somebody on injections or transdermals, it kind of goes up, stays up for a while, then slowly comes down. Normal testosterone doesn't do that. And that's what the oral lymphatic form is going to do. So it's going to be much more physiologic. By doing that, you're not going to see as much conversion into estrogen, as much conversion into DHT, or as much suppression of your own testosterone or your own testicular function. It doesn't lower sperm count. So it's a really nice option, especially for younger people, but even for older people who really want to get a more physiologic balance of their testosterone. I think the big key point here is if you're not feeling yourself, male or female, we need to test levels. And the other thing I really want to make a point of is that too often I see guys blocking estrogens when they're on testosterone. Estrogens are critically important. And if you're running higher testosterone, you need higher estrogens. It's rare that we need to block estrogens. And in fact, that estrogen that comes from the testosterone in men is critically important for brain health, for cardiovascular health. So really, you have to have all these hormones balanced. That's why you need to work with a physician who really understands this stuff. Test your levels. Start testing your levels even when you're younger, especially if you're having symptoms that you can't explain. Work with a doctor that understands this, and you're going to get good results.